Today we are going to learn about anastomosis around elbow joint. This topic is very important for clinical point of view. For better understanding about this topic, I am going to draw the lower end of the humerus. This is the lower end of the humerus, which has two condyles and two epicondyles. This one is the medial epicondyle and this one is the lateral epicondyle. The medial epicondyle and the lateral epicondyle. Medial epicondyle is more prominent than the lateral epicondyle. Okay, this anastomosis around elbow joint occurs 8 branches. 4 collateral branches and the 4 recurrent branches. First, I want to tell you what is the collateral branches and what is the recurrent branch. As we know, the normal blood flow is up to downward. As we know, the normal blood flow is up to downward. If any artery present parallel to the normal flow artery, which means this also has a normal blood flow from up to downward. This known as the collateral branch. And if any artery has opposite blood flow from downward to upward, known as the recurrent branch. Got it? So, the arm region, the brachium region has a brachial artery which is divided into two terminal parts. This is the brachial artery and divided into two terminal parts. This is the ulnar artery and this is the radial artery. Okay. As I already told you, this anastomosis has 8 arteries which communicate with each other. We got 4 branches from brachial artery. These are collateral branches because they run parallel to the brachial artery with normal blood flow from up to downward. So, first branch known as the Profunda brachial artery, which is divided into two parts. Which is divided into two parts, radial collateral branch and middle collateral branch. I have drawn this one is dotted because it is going behind. Brachial artery has two another branches. One is superior ulnar collateral branch which is going behind and inferior ulnar collateral branch. These all are the collateral branches because they run parallel to the brachial artery. Now first name them. This is the Profunda brachial artery. This is the middle collateral branch. And this one is the radial collateral branch. This is the superior ulnar collateral branch and this one is the inferior ulnar collateral branch. These all are the collateral branches because these branches run parallel to the brachial artery. We need 4 recurrent branches. First, we have first recurrent branch from the radial artery. From this radial artery. It has an opposite blood flow from downward to upward. That's why these branches are recurrent branches. This is known as the radial recurrent branch. Radial recurrent branch. Second, from the ulnar artery, known as anterior ulnar recurrent branch. Anterior ulnar recurrent branch. Third, also from the ulnar artery, which is the posterior ulnar recurrent branch. Posterior ulnar recurrent branch. Now, the last artery, which is also a branch of the ulnar artery, but this one is not a direct branch of the ulnar artery. Actually, ulnar artery give a branch which is known as the common introitious artery, divided into two parts, anterior introitious and the posterior introitious. This posterior introitious artery give a branch of recurrent introitious artery. This is common introitious artery. This is anterior introitious artery. This is the posterior introitious artery, and this one is the introitious recurrent branch. Now we got 4 collateral branches and 4 recurrent branches. Like this. This middle collateral branch anastomoses with the posterior introitious artery behind the lateral epicondyle. This radial collateral branch anastomoses with the radial recurrent branch on the anterior aspect of the lateral epicondyle. This superior ulnar collateral branch anastomoses with the posterior ulnar recurrent branch behind the medial epicondyle, and the inferior ulnar collateral branch anastomoses with the anterior ulnar recurrent branch anterior to the medial epicondyle. So this is all about anastomosis around elbow joint. Yeah, we can say the collateral and recurrent anastomosis around elbow joint. For notes, you have to go to my Insta ID, which is Anatomy with Anna. I have already mentioned this in my description. Thank you.